Welcome to Action on Pain, a podcast dedicated to highlighting the significant efforts underway in Canada to address chronic pain.
By presenting perspectives from individuals who live with pain, researchers, clinicians, and other stakeholders, we explore various impacts on people's lives and the initiatives, research endeavors, and the committed professionals working to effect meaningful change.
This work is guided by Health Canada's Action Plan for Pain. Join us as we raise awareness and share stories that are shaping the future of pain management in Canada.
Welcome to Action on Pain, a podcast where we explore the landscape of chronic pain. I'm Keith Meldrum, and as always, I'm joined by Jennifer Daly-Cyr and Virginia McIntyre.
That's right. We're your hosts. I'm Virginia McIntyre, and like many of you listening, we navigate the daily realities of persistent pain.
And hi there, I'm Jennifer Daly-Cyr, and our mission is to shine a light on the progress being made within the framework of Health Canada's An Action Plan for Pain in Canada to make a real difference in people's lives. It is our pleasure to welcome Lynn Cooper today. Lynn is a person with lived experience with persistent pain resulting from a workplace injury. She advocates for people with lived experience voices and perspectives to be embedded within pain care research, planning, service delivery, and healthcare system improvements. Lynn was the president of the Canadian Pain Coalition, which disbanded in 2017. She spent more than 20 years volunteering with organizations that seek to better understand issues surrounding chronic pain and furthering research into and management of chronic pain. Lynn sits on the Chronic Pain Network Steering Committee, and we are so eager to hear her insights around goal number 3, which is education for all impacted by persistent pain.
Lynn has an extraordinary background of 20 years with advocating. I had the pleasure to first meet Lynn was in 2022 at the Montreal Canadian Pain Society annual scientific meetings. And Lynn, being another person who lives with pain, took the time to reach out to me, to invite me to sit down and have a meal with her that evening. And to sit there with her was so heartwarming when I knew very few people there. And just with another person who lives with pain, who's been a workplace injury, it was really nice to have that one-on-one and share and connection. And ever since, Lynn and I have been connected. She's a special person.
Incredible.
That's great. It is truly our pleasure to welcome you joining us today, Lynn.
Thank you so much, Keith, Virginia, and Jennifer, for having me on the show with you. It's my pleasure to be here. Hi, everyone.
We're going to just start right off, Lynn. So, we understand that you've been a pain advocate for more than 25 years, and that's an advocate, an educator, a community organizer towards improving understanding, prevention, and ethical management of chronic pain, formerly the president of the Canadian Pain Coalition. Wow. So I want you to tell us a little bit about how you got involved first in pain advocacy.
Wow, that takes me back a few decades, I think. Well, I was first injured in a workplace accident. Actually, it was a preventable injury, one of those so sad, in 1986. And then things just developed for me with the best care that we had at the time, the best knowledge we had at the time. But I was one of the 20% of individuals who can go on to develop persistent pain. And from then on, it was really a choice for me to get involved as I could, having developed fibromyalgia and neuropathic pain from my waist down because of the workplace injury and migraines. And the very beginning, I suppose, was when I told my story in 1989. That's when it started at the University of Waterloo in Waterloo, Ontario, in front of an auditorium full of healthcare providers. That was the longest 5 minutes of my life, I think. And that was the first time I shared the person with lived experience to anyone.
That's incredible because that's something they didn't do back then either, did they?
No,
I was just going to
no.
say it's interesting. We've had a little bit of a connection. So my pain journey goes back to 1986 as well. And like I say, the best evidence that we had back then, which my personal experience was not very good. But I think it's amazing that by 1989, you were already in a position where you were able to start sharing your experiences and your story. Because I was a very slow learner to that. It took me a long time. So total respect to you for being able to, in that short period of time, be able to get up in front of those people and
That's
do that.
incredible.
That's amazing.
I wasn't happy
Mhm.
with the term chronic pain
Mhm.
at all.
Mhm.
And so they suggested that I call it persistent.
Oh,
And that freed me, folks, because yes, the pain is persistent in my life. But I realized that I could be persistent in how I learned to adapt my life with it, how I lived with it, how I moved forward with it. And that helped me to start taking back my personal power and looking for things that could help me. And then in turn, wanting to make that difference for others so that they didn't have to go through what I was going through, stigma, the discrimination,
yeah.
the lack of understanding.
That's phenomenal, Lynn. I mean, when I think about you standing in front of a group of practitioners like that, a room full of them for 5 minutes, and I can appreciate that 5 minutes would have seemed very, very long. And your foresight to know that combined with hearing the word persistent, your foresight in leveraging that, not for yourself, but also for others.
That was the moment that I realized, along with the work that those two psychologists were doing within a local group of healthcare providers that were from Waterloo Region, Hamilton, and Toronto, who formed a small group called the Pain Action Network back in the day. And they invited me to be involved as their patient. Now, thankfully, we're called people with lived experience, but I went through all the issues of being called a patient and referred to that way. And, you know, evolution is finally happening.
Absolutely. And Lynn, you talk about that in a word, question. Did they invite you to speak at this? And then how did the advocacy grow? Because I know you've been constantly involved with a lot more things.
I became involved with that little pain network, as it was called in this area. And then I also became involved with the Fibromyalgia Association of Canada, and I worked, and that was affiliated with the Arthritis Society, Ontario division. And so I became very involved with advocacy and organizing. And at one point, I was involved with helping to support over 40 self help groups in Ontario for fibromyalgia. And then I was approached by the Arthritis Society to be a national advocate for them, speaking about all the voices. So the people with lived experience, the healthcare providers, and the researchers. So that is how, and I said, yes, that is how I became involved. And that was the beginning of the Canadian Pain Coalition, which really operated at the time as a sister organization of the Canadian Pain Society. And so we did a tremendous amount of work together as organizations. We shared positions on our respective boards. The coalition, the CPC, I'll call it for short, really put forward the voice of people with pain. And when National Pain Awareness Week was created and established in the Senate in 2004, then it was the Canadian Pain Coalition who led the charge and the development of the national awareness. And of course, that has been picked up by Pain BC for many years and now Pain Canada and others. And I feel we were, with the concept of CPC, we were way ahead of our time, ahead of the political climate, the understanding of chronic pain, the acceptance of chronic pain, and certainly chronic pain being recognized as a disease, which it now is, but all of the advocacy work and the education work that we did was to start breaking down some of those barriers, so that when we finally got to a collective meeting of many voices with the then Minister of Health, the Honorable Jeanette Petitpas Taylor, that began the inquiry for what has become, through all of the work from so many advocates and educators and policymakers, to create the Action Plan for Canada. And, there's a lot of other history. There were several pain summits. One that I was involved with was in 2012. That's in 2010. The Canadian Pain Coalition and the Canadian Pain Society worked to create almost a mini action plan. And we brought that forward in a pain summit that we held at the Chateau Laurier in Ottawa in April 24, 2012.
Lynn, you're thinking 2012, and I'm thinking on my head, like, wow, that goes way back. And I'm so glad that we've have you here today. But I'm also thinking is we're now been advocating for people with lived experience at the table, and they were doing that.
We were doing that. And I remember folks being in meetings where I was met at the door and told that I really wasn't welcome, but I was here, so I may as well speak. But I remember being talked to where I was told, "Don't worry, Lynn, you don't need to say anything. We're taking care of the patient."
So, how do you respond to something like that, Lynn? Probably with grace and elegance, as you always do. Yeah.
Yes, with that and some force behind my voice to say, I really feel that there is so much that the people living with pain can add to the discussions about policy, the focus of your research and education for our healthcare provider students and continuing education. Another, for instance, 2010, I heard that there were an incredible group of individuals who were thinking about doing guidelines for the prescribing of opioids for the first time in Canada.
Really?
At that time, I was president of the former Canadian Pain Coalition, and I brought forward the idea that there should be people with lived experience at the table to help inform and to share our experiences about using opioids and the concerns we had and all of that together. And what I managed, with some persistence and with some folks who were very supportive of the person with lived experience voice being included. I mean, it takes all of us working together to make it happen, right? I was able to get that place as a voting member of the panel, which then was a consensus document. It was created that way. And I didn't do it alone. I went back to CPC and I said to the healthcare individuals who were members and on the board of CPC, the researchers, the other organizations who were of people with lived experience who were members of CPC, I said, we need to form a working group here. I do not alone have the expertise about this. So whenever there was work to be done on those guidelines, we acted on it as a team, and I voted according to what our team said. But it was a team of the three necessary voices: the people with pain, the clinicians, and the researchers.
I just need to state the obvious because I'm very good at that. Just ask my wife. But a lot of the things that we're seeing happen today, you've explained, like Virginia said, over a decade ago, you were instrumental in that was happening. But the light, because I think back to that time, and I felt all of this was in the darkness, and to hear all of the amazing work that was happening, and maybe over on the West Coast, we were in the dark, but you were doing all the things that needed to be done. It just wasn't out there as much as it is now. But you guys were laying that foundation. You were building this map. You were starting this journey. And it's incredible to hear the advancements and the seats at tables that you had and the voices that were heard. It's incredible, Lynn.
It really was quite a journey, I will tell you.
Mhm.
And you think about the difference now. Think about the difference that social media has been developed.
Yeah.
And for lots of good, but for lots of challenges as well. We think about the education platforms that now exist for resources for people with lived experience with pain. So the resources on Pain Canada, Pain BC, the Power Over Pain portal that I'm so proud to be on the
Mhm.
development and maintenance team of. But back in 2009, the CPC and the Canadian Pain Society created the Pain Resource Center, which was the very first web-based place for people with pain and even healthcare providers to get evidence-informed knowledge about pain and pain management.
Wow.
And Lynn, you must have been amazed. Just like, I'd like to know, what do you did all this work? What were your thoughts when all of a sudden they're coming together with the Canadian Pain Task Force,
Mhm.
this action plan? Like,
Yeah.
because you guys had done a lot of work
Yeah.
to get, and with hopes, I'm sure, to see something like this happen.
Absolutely. I was, to quote my father, over the moon.
Mhm. No
Over
doubt.
the moon about this, that there enough synergy
Mhm.
had come together, and the right people in the right place at the right time and the right political climate when CPS and CPC and AQDC, l'Association québécoise de la douleur chronique, held that summit in 2012, the political climate was not there for even anyone from the sitting government to show up and support it. So many changes, so much work by all the advocates, people having the courage to speak up, not just the people with pain. That's really important, but healthcare providers wanting changes in the system, educators wanting to ensure, I'm speaking healthcare educators, wanting to ensure that their students coming through have the knowledge. So, I've been working on competencies for healthcare professional students for many years now and seeing some really good results. But even, last year, and again, we repeated it this year out of McGill University with Dr. Tim Weidman. Last year was the very first year that we had ever seen a one-on-one, that I'm aware of anyway, a one-on-one opportunity for physiotherapy students to be able to meet for an hour with a person with lived experience.
That's
Yeah.
striking in terms of the
Yeah.
impact that can have on learning, isn't it?
Yeah. And so you asked me, well, which of the goals, which one would I choose to talk about? And I'm thinking, well, I have attempted in my own way and with others to really drive everything forward with all of them
Mhm.
because we needed to do it all in tandem. But I honestly think that the education one is the one that I have so much passion for. You want to know
Of
why?
course. Yes, of
Yes,
course.
It's
please.
because it's because education, and knowledge is power. It's power for the person with lived experience. That's what made the difference for me.
Mhm.
The knowledge. My body was living chronic pain for 3 years before I knew the difference between acute pain and chronic pain.
Mhm.
And once I knew that difference and I moved to persistent, thinking of it as persistent, that's when I took back my power and I started to learn. And I started to build my toolkit and I developed my pain plan.
Mhm.
And I've been teaching that recipe
Mhm.
all these years to peers. And then the education for our healthcare providers. They need to understand what we go through as people with lived experience.
The big picture, right? And what is in our own individual backpacks.
Yes. And they also need to be able to have some practicums,
Yeah.
some experience in working with people
Mhm.
rather than taking a multiple choice exam. And that's the
Mhm.
knowledge that they have about chronic pain.
Lynn, so I heard and I can appreciate, especially now learning even more about your background and what brought you from
Mhm.
1983 to here. I mean, I'm just blown away. And would you say that understanding that all of the goals are important? I understand. I happen to share that thought. For the education piece, do you feel that there has been a movement in the dial since the action plan came out? Do you see things in the works that's going to have an impact on the dial as we go forward?
I do. I feel that the action plan has had influence. I think also that many things were happening at the same time. And I think what happened was we reached a tipping point where we finally got the flow over the top of that mountain.
Mhm.
Climb, climb, climb. We need education here. We need education there. We need improved awareness. We need more research. We need people with lived experience in the research, not just to lend their name like so many people asked me to do.
Right.
I had to fight for that, folks, where we need more than, yes, you can have my name, but now what is it that I'm doing on this? I want to be part of creating the research. Oh, no, no, no.
Yeah.
We won't do
Yeah.
that
Yeah.
yet.
Almost
Yeah.
there.
We won't do that
Yeah.
yet, but it's all coming. So I think everything, Jennifer, was coming together along with the action plan happening. What was so fantastic about the action plan was the fact that there was funding and belief from Health Canada in this and Secretariat support to be able to actually hold meetings in the regions in
Mhm.
Canada, whereas before, almost everything was done in a volunteer capacity,
Mhm.
and there wasn't that funding to be able to do it. So this is what really brought things into focus. And those consultations that happened in Atlantic Canada, Central Canada, Western Canada, all came together with people with different regional issues and challenges, perspectives, but all saying so much of the same thing
Mhm.
about what was needed in Canada to get that down into that document.
And from your perspective, Lynn, what do you think is needed to push it well beyond this point? Do you have a sense for that?
I think more of the same. I think we need continued support for Pain Canada
Mhm.
and initiatives like the Power Over Pain portal. You see, what can happen for some of initiatives is that there is funding for a while and then there isn't. And the good that is established, and it takes time to build I know it takes time to build
You do.
from all of these years to get people to learn about the different resources that are out there and how to use them. For instance, with the portal, we really would like it to become part of stepped care, where it could be used and is being used in pilot ways as the basis of information in stepped care when people are waiting to get into pain clinics. If
Just
they
interrupt for 1
yeah,
second, Lynn, just for our listeners to say the portal is the power over pain.
Yeah.
To
Power
bring that
over Pain
forward.
portal, yes, where the resources there can be prescribed as basic information that
Mm.
people can learn, and so that they have some idea about what chronic pain is, how it impacts your life, many different ways that they can have influence on it. And then when you get to the health professionals at the pain clinics, then everything about the care that you can receive from them is far enriched because you have some of the base knowledge. And on it goes. But if the funding doesn't continue for Pain Canada, for the Chronic Pain Network, and for initiatives like the Power Over Pain portal, then things stop. And that can be a real challenge. And I think what many of our politicians don't realize and our policymakers don't realize is that when initiatives show promise, then you keep funding them. you know?
Yeah.
And we also need help to be able to prove that these initiatives are making a difference.
What saves money? What?
So that we
Yeah.
need the research. So folks, I'm right back to all the goals.
Right. Yeah.
So I mean, they all fit together, but I really think where the power can happen is in the education where healthcare providers learn what it is, the multimodal, multidisciplinary ways that we have to approach it, including self-help, but not solely relying on self-help. The onus, Jennifer, Virginia, Keith, and me, should not be on us completely to manage our pain. We need our healthcare champions to help us to fine tune our strategy. And so, therefore, our healthcare providers must have that education
Yeah.
about it.
I'm a believer.
You know, I think, Lynn, you have just shared with us such a richness and a depth of the decades of experience that you have leading up to what ultimately became the task force and then the action plan on pain. So I think this is a great point for us to wrap up. And I'm hanging on a comment that you made. And I think this, to me, says so much about the conversation we had with you today, that education is power. You've demonstrated to us that, your work going back to 1989 and the challenges that were faced at that time with everything that you talked about. I'm amazed and thankful for your persistence to keep pushing that rock uphill and not giving up, because I'm sure it must have at times felt like a daunting experience. But because of people like you who kept your shoulder to that wheel and kept pushing it up and up, ultimately led to all of that work that you did, to the task force and ultimately the action plan for pain in Canada. And education is power. I think that's just a beautiful way to wrap up this conversation. So thank you.
Well, thank you for the opportunity to be with you.
And I'm also, just to finalize my thoughts, the power of your first story, that 5 minutes, and
Yeah.
where it has led you to today, and the ripple effect that will continue to have on people with lived experience, clinicians and researchers through all of your efforts is really stunning and very impactful. So thank you for that.
I feel that I worked with a tremendous group of individuals. It wasn't just me. It was a small group of individuals who had belief that we needed to change the way pain is seen. The pain could become a health priority in Canada, that it could be recognized for the disease that it is, that there could be more than just the small group morphing into the larger group with all of its tentacles out now. People sharing their stories, people inspiring others to get involved. That was why we did what we did, and that's why we continue to work together to make a change and inspire others.
Well said. Virginia, did you want to wrap us up?
Yeah, I'm just going to say thank you. It has been a pleasure to have you, and we are grateful for everybody. We'd like to thank all of you for tuning in to the Action on Pain podcast. We hope that this episode has shed some light on the important work being done in Canada as guided by Health Canada's Action on Plan for Pain in Canada. Until the next time, keep listening.
Thanks, everyone.
We'd like to thank all of you for tuning into the Action on Pain podcast. We hope this episode has shed some light on the important work being done in Canada as we guided by Health Canada's An Action Plan for Pain in Canada. Until next time.
Thank you for joining us today on Action on Pain. If you enjoyed the discussion, please follow us on your preferred podcast platform to stay updated, and please share with your networks. A 5-star rating and review would help others find our show. Your feedback is important.
This podcast does not contain any medical advice. Please consult with your doctor if you have any questions or concerns.
The Action on Pain podcast is made possible by the generous support of the Chronic Pain Network, a national research and knowledge mobilization network.
The views, opinions, and content shared by hosts and guests are their own and do not necessarily reflect those of the Chronic Pain Network or its funders.